Hello again, I'm Ken Isaacson. This week's buzz topic is contact tracing. With us today to tell us about contact tracing in Whalen and what's involved are Ruth Morey, Whalen's public health nurse, and Noreen D'Amico, the community health nurse at Claypit Hill School. Welcome, Ruth and Noreen. Thanks for being on the buzz.
Thank you for having us.
Yeah.
So you're probably busy, so let's get right into the questions that we had and we talked about. Ruth, could you give us and our viewers an overview of Whalen's COVID-19 status as of June 17th? What direction the numbers are going? What was it like this week? Confirmed cases, things like that.
Yep. So I'm happy to report we have 106 cases as of this exact moment, because I did just double check our numbers before we started our interview today. And what we're seeing is this week we had one additional case. Last week, our numbers actually appear as though they have stayed stable, but we actually were at 105 last week. So we're doing good. We really have not increased our cases in the last 2 weeks. Mm-hmm. Our numbers have, really gone down, and so we're really wondering as we start to open up what we might be seeing, but currently in Whalen we're doing well.
Well, that's good to hear. Do you have any can you how are things going in our surrounding towns? Do you have any data on that?
I haven't reached out to our surrounding towns. I mean, we've been looking pretty similar, or actually a little bit less than some of our surrounding towns.
We're on the same paths.
Yeah, yep. And
okay.
And just as some of our surrounding communities, a large, I'm going to call it burden of disease, a large population of our disease is focused on our long-term care facilities, which include our nursing home and 3 assisted livings. Mm-hmm. Which is very in step with our abutting communities.
Okay. How does the Whalen Health Department interact with the state health department regarding COVID-19?
Sure. Well, COVID-19 is really no different than any other communicable disease. So there are certain reportable communicable diseases that when someone has some sort of lab testing done, whether it be a nasopharyngeal swab, or we call it the PCR, that is being done currently for COVID. It might be blood testing that's done. When something that is tested comes back abnormal, it is legally required for that lab to report it to the Department of Public Health. And then the Department of Public Health provides that information to where the individual resides. So that's how COVID is working as well. So anyone who has a confirmed positive and now probable, those are a little bit different, but those results come directly into Whalen through a high-level secure system.
From the state down, it comes down from.
Yep.
Okay.
Yep.
A little context here. Can you explain exactly what contact tracing means?
Sure. So contact tracing really is the sort of an in buzzword, but really this is something that public health nurses have been doing forever, because this is what needs to be done whenever there's communicable disease. So when you have someone test positive for communicable disease, it starts getting into sort of like the private investigation of what the different variables are to sort of figure out who is the index case, and then potentially who has been exposed, because we certainly want to do what we can to prevent further disease spread. And that we do that currently with COVID by finding out who may have had an exposure or been around a particular individual who's tested positive for COVID. And then what we do is we contact them, make sure that they quarantine, stay out of the public eye to prevent further community spread. So that's really in a nutshell what contact tracing is.
And does what Whalen's doing, how does it compare to what the state calls their contact tracing program? Is it the same thing?
Sure. Yep. So when COVID started, we did not have enough public health nurses and individuals in our Commonwealth to be able to potentially look at the increasing numbers of individuals it would take to do contact tracing in Massachusetts. So that's how Massachusetts started the contact tracing program. And we are very fortunate here in Wayland that not only am I able to do the contact tracing, but the nurses who are under the health department but work directly in our schools have, and our sub-nurses have also been working directly with me and have gotten trained on all the steps in terms of what needs to be done for communicable disease follow-up for COVID-19. And they have also been working. So we don't have any of the state contact tracers involved with Wayland. It is really Wayland employees working with our Wayland residents. And we all know each other through various situations, so it makes it for a very positive situation for all. So it's not strangers calling our residents, which I'm very fortunate that we haven't had to take that on at this point.
And Noreen, you're involved with that in that process, right? Are you in charge of what's going on with the contact tracing program?
Yes.
How has it been going?
It's going well. We actually started doing the contact tracing back in March, so we're several months into it. And we've pretty much got this down now. There was a learning curve in the beginning, and the state provided training for us because typically our day job, we're school nurses. Ruth is, of course, versed in doing this, but the rest of us are school nurses. The state provides training, ongoing training for us so that we're always kept up to date and we're able to provide the latest up-to-date guidance for our residents.
How many contact tracers do we have in Whalen?
So I would say, including Ruth, there's about 7 or 8 who are currently doing it right now.
Mm-hmm.
How much of a burden is that on each person in terms of the numbers of people you're winding up to having to talk to?
You know, I don't think it's been much of a burden for any of us in that we're able to distribute the cases as they come in. If one of us is busy with a larger facility, like I was involved with a long-term care facility, the other nurses can handle the other cases. So it really isn't, we are not overwhelmed in any way.
Well, that's good to hear.
Yeah.
I would assume it's a fairly challenging job.
Yes, it is. I mean, school nurses are not, we are used to reaching out to the public. We do follow a lot of communicable diseases with the school population. We are accustomed to performing interviews, so I think we're, well positioned, uniquely positioned to do this job in Wayland.
Mm-hmm. Okay, let's talk a little bit about the current testing. Can anyone who has minor symptoms now get a COVID test?
Do you want to take that, Ruth?
Sure. So the short answer is yes. The testing availability has greatly increased. So at this point, if anyone is feeling as though that they have symptoms that may be related to COVID, we certainly encourage everyone to follow up with their direct primary care physician to determine, what the thought process is and potential testing. And the physicians' offices either are referring individuals or are doing it themselves, but also all our local urgent care facilities have also taken on being able to offer tests, and that is so that if somebody should not have a current primary care or they feel that they, regardless of maybe what their primary care physician is stating, that they really want to be sure that they're tested, they contact, so often they'll contact us, but what we advise is that you contact the urgent care that you want to go to, because there is a physician who does a, telehealth visit and then determines regarding your symptoms and whatnot about testing, and then setting up a testing date, an appointment.
But what about the testing for to see if you for antibodies to see if you've had it? Is that readily available?
So the antibody testing that's currently out there is available, but there has been some potential concern about how viable it is in regards to, how much percentage of accuracy it holds. Is it 95? Is it 98? Is it, so there's questions in regards to accuracy. There's also questions in regards to what actually those antibodies are telling us. Are they telling us that you have a current infection? Is it showing a recent infection? So there, it's not, so currently Department of Public Health only supports antibody testing if there's going to be also a nasal swab going along with it to look at the whole picture.
I see.
So.
Yeah, I mean, I've heard that that the testing for whether or not you have it is not all that accurate either. So I guess all of it's kind of like a little fuzzy because of the way this virus operates, huh?
Yeah, I think in regard, I mean, the what we call the PCR, which is it's really sort of like I'm going to call it a deep nasal swab. That has been sort of that is considered to be the standard right now for diagnoses. But we all know people who are, at least many of us know people who may have swabbed, they are symptomatic and they may have swabbed negative, and then they go back again and then they test positive. So some of it has to do with the level of illness that you're at also. But it can be very confusing in regards to COVID. I agree with that.
Okay. Noreen, I want to ask you, you've been directly involved with the contact tracing. How many people who test positive that have you done tracing for?
So I dealt with a long-term care facility in addition to other residents in town. So I've been involved with about 30% of Whalen's cases.
And there have been how many cases?
We've had 106 positive confirmed cases, and then we also follow their contacts.
So that 50% includes the contacts?
A little bit more. So with the contacts, we've been in contact with about 139 residents of Whalen.
Mm-hmm. Okay. And how much time? How many on average is there, or is there an average of how many people these initial people have been in contact with?
So are you asking how much time is involved?
No, well, that too, but I was just curious to know, in addition to the actual people who have tested positive, is there an average number of people that they've been in contact with?
Oh, I see what you're saying. Yes. Yeah. So since people are practicing socially distancing, the number that I've heard and my own experience has been that typically that initial contacts has had contact with about 3 other people.
Okay. Just curious about that. And how much time does it take to complete the average tracing? I guess it's a phone interview, right?
It's a phone interview. So, we follow the case through to completion, whether that's isolation or quarantine. So isolation is a minimum of 10 days, and quarantine typically runs about 14 days. But regardless, whether they're in isolation or quarantine, we follow that resident through the entire course, either to recovery or release from quarantine or isolation.
And as far as your actual interview with them, how long does it take to do an interview?
Well, we use the interview tool that's provided by the DPH, Mass Department of Public Health, and it goes through a series of questions. I would say the average interview is about 10 minutes initially, and then we follow up with the resident either daily or it's really as needed. If the resident is not improving, we'll be in contact with them on a daily basis.
I think we have a copy of that form. And if we do, we'll put it up on the website. I believe we got a copy of that. How do people respond when you call them, telling them why you're calling?
Yeah, you know, if we're the first ones to call them, they're pretty surprised. In some cases, they have not heard back from their primary care doctor, or we're informing them for the first time that they're a contact of a known exposure. I would say that most of the residents, they're completely cooperative. They're happy to hear from us and have their questions answered. We're able to provide resources for them. If they have any question, they're given a number that they can call us back at. So overall, it's been a very positive experience for me. I live in town. I know, for the most part, I know many of the residents that we're calling, having worked in the school system as well. So people are familiar with generally familiar with our names. We identify ourselves as community health nurses from the Whalen Health Department when we call. It's a little different. When we call, unlike the CTC, you won't get a pop-up that says this is the CTC calling. So it's important that we notify the residents that we do work for the town of Wayland. If they have any concerns, they can always check in with the health department for confirmation that they're actually dealing with a community health nurse. But that has not been my experience.
Yeah, because I'm sure that some people would be concerned that you haven't experienced that somebody's calling and scamming them. Right.
So we're very careful to identify ourselves as community health nurses working for the health department of Wayland.
Yeah. Okay. What's the experience? It sounds like the experience hasn't been that difficult doing these calls. I would imagine in some cases it might be very emotionally challenging.
I would say so, especially, in the case of our long-term care facilities or our assisted care facilities, we develop relationships with the facilities. And when a resident passes, it affects everybody quite deeply. And we do follow them for quite a while. So, those can be some tough days. But on the other hand, when we're able to call a resident and tell them that they've completed their isolation or quarantine period, that's delightful. That's great. We tell them that they can resume public activities, and that's a good day.
Mm-hmm. So you go all the way through, no matter who the contact is. You count the number of days until they're out of quarantine, and then you notify them again that they're clear.
That's correct.
That's of course you hear otherwise.
Correct.
Yeah. Oh, that's good. Finally, what's the recommendation for people who are in contact with a person who's tested positive? How would you describe someone identified as a contact?
Well, the recommendation would be to get a deep nasal swab test and to notify the primary care provider.
Or go to the urgent care center, right?
Right. Right. There's a very low threshold for testing now. So, in months past, it was difficult to get the test. That's not the case now. We want as many people to get tested as possible. As far as who is a close contact, anyone who has had exposure to a known COVID positive individual and has had 15 minutes of contact within a distance of 6 feet. Mm-hmm. So that's the official definition for close contact.
Okay. Well, before we go, is there anything else either of you would like to add that we haven't covered?
Just if, we're always remain here if anybody has questions in regards to any questions or concerns regarding COVID. They're welcome to give us a call at the health department, 508-358-3617. and we're continuing to, we're involved with all areas of reintegrating back, for our community as we increase or as we start opening more things up within the community as well. So, we are following information. And I would say that the other thing is just that I feel fortunate that we here in Wayland have all been able to work together to, try to get us through the time that we've had in the fall, this past spring, I should say. And we certainly look forward to things opening up and people staying safe, and that we don't increase our numbers as well, So, but if anybody has questions or concerns, they're always welcome to give us a call or email us.
Yeah, and I would just like to say that as the cases do decline, it will remain a priority of ours to contact every individual who is positive and every individual who has had contacts. We can't take our foot off of the gas just yet, and Wayland is pretty dedicated to seeing this through. We have a nice cadre of nurses here in Wayland, and we're well suited for the task. So it's been a pleasure to do it, and I do enjoy speaking to the residents of the town, and I hope they have a positive experience when one of us does call.
Yep.
Okay. Well, thank you both. It's good to hear what's going on and to hear how well you guys are taking care of this problem, or trying to anyhow. And so thank you. And good luck with, and let's hope that your work goes away soon.
Yeah.
Yes. Thank you, Ken.
Thank you, Ken.
All right. Take care.
Thank
You too now.
Bye now.
Bye.